on Ascarid impactions in young horses. This is a really frustrating condition in young horses. Basically, after they're dewormed, the roundworms or the Ascarids get killed off, and because they're large worms and occur in large numbers, when they're killed off, they actually form a knot of dead worms in the intestines and cause a blockage. And this usually occurs in the small intestine. Presenting information, these horses are generally weanlings, yearlings, or even still foals that are on their mom. They have roundworms, and they've been recently dewormed, probably for the first time in their life. When they present, they have mild to moderate colic signs, and they usually don't look like your healthy, well-kept foals. They're a bit unthrifty, rough hair coat, pot belly, stuff like that. They will usually reflux because the obstruction in the small intestine means all those secretions are backed up into the stomach. So I'm not going to talk about it now, but something to think about would be, why is the sage range the one that's affected? You don't see it in older horses, you don't see it in younger horses. And what other signs do roundworms cause in horses, and why? Diagnosis of roundworms is generally made at surgery because you take them because of the obstruction. Sometimes you can see them on ultrasound, and we'll go into that in a minute. Just because you see roundworms in the manure or in the reflux, it's disgusting, but it's not diagnostic for an Ascarid obstruction. It is diagnostic for a roundworm problem. These ultrasound pictures are from a 3-month-old thoroughbred filly that presented with acute respiratory distress. She was down, cyanotic, having difficulty breathing, and then quickly died. On an ultrasound, this is very distended small intestine, and you can actually see roundworms in it. So on the left, you can see cross sections of roundworms because you're catching them head on, and on the right, you can see a longitudinal view. The small intestine is very distended. You don't usually see it in these round loops, and it's got a really thickened lumen. You can see the folds of mucosa. There's also excessive peritoneal fluid from the irritation. Unfortunately, some other pictures in the same foal, you could actually find free-floating roundworms. There's a lot of peritoneal fluid, and then the arrowhead is pointing to a roundworm that's not in the small intestine anymore because it's ruptured. You can see the even more thickened small intestinal lumen inside the very distended small intestine. Roundworms are not a good thing to have. We think they secrete a toxin that interferes with motility, and that can lead directly to intussusceptions, like in the lower right picture. You've got some dead small intestine intussuscepted into another piece of small intestine, and roundworms all over the place. They change the motility and lead to this sort of problem. Even without rupture, they can lead to peritonitis and damage to the intestine, which leads to adhesions down the road, as in the top picture. That scarred small intestine, things aren't moving through very well because that's all kinked up. And finally, as we saw, they can lead to intestinal rupture. Unfortunately, Ascarid impactions have a relatively high fatality rate. Treatment involves referring. These guys need quick attention before things get further along. They need surgery to remove the intestinal blockage, and if the intestines get damaged enough, they're going to need to remove that chunk of intestine and reanastomose the ends. Obviously, it's much better to prevent these. So the first time a foal is dewormed, especially if there's high stocking density or high risk of Ascarid impactions, we want to deworm with a product that doesn't kill all of them at once. So we use a half dose of bendazole or one of the other older deworming agents that just doesn't work as well as some of the newer products. We want to kill fewer worms at a time and then go back and kill the rest later. Often we treat these foals with mineral oil at the time of deworming. That helps the worms slide through and may help prevent the toxins from being absorbed. And you want to be really, really careful when you're deworming rescue horses. You don't know their deworming history, and they may not have any at all.